Hello, I'm Dr. Sylvia from Cutis Medical Laser Clinics. Today, I'd like to introduce our Ultherapy VIP or Visualize and Personalize program. Ultherapy uses targeted ultrasound waves into various layers of the skin. These ultrasound waves are converted to heat that then stimulate our own cells known as fibroblasts to build collagen. We target deep into the second layer of the skin, known as the dermis, as well as in the layer underneath the skin, known as the SMAS layer. This is the ligament that holds our skin in place. As we get older, we lose collagen in these layers, resulting in sagging and laxity and reduction in skin quality. Ultherapy works to build collagen in these layers up to a year after treatment. This is a procedure that is US FDA approved. I believe in this treatment because there are numerous publications resulting in improvement in outcomes with the use of Ultherapy. One of the most important aspects of doing Ultherapy is the ability to customize the treatment. This is where the Visualize and Personalize program comes in. Ultherapy is technique dependent. This means how you do the treatment makes a difference on the result and can make a difference in terms of the risk. How does this work? Well, with Ultherapy, you're able to visualize the skin. You want to target the layers that contain fibroblasts, or the cells that make collagen. These are the deep dermis, as well as the tissue under the skin, known as the SMAS layer. It supports our tissues and keeps us appearing lifted. If you go too shallow, you're not going to target the correct layer and you're not going to create a lifting effect. If you go too deep, you will then go into the deep fat pads of our face, may potentially increase the risks of the procedure. This is why we start with planning before we do the treatment. This is where we do the Visualize and Personalize program. There is no one-size-fits-all with a treatment. Sometimes the target layer, like the SMAS layer, or the layer that holds the skin in place, is shallow in certain patients. For example, in Caucasians, where the fat pad on the face is less. And the entire plan for the treatment will need to be different because doing the standard or traditional protocol will be too deep for that person, potentially increasing risks without maximizing collagen building or lifting. Sometimes we actually change the depth of the treatment on different parts of the face or on different sides of the face. Because it is important to target the correct layer in order to avoid complications, it is important to have the treatment with a doctor who does Ultherapy procedures quite frequently and who has experience and is familiar with the imaging and the Visualize and Personalize program. This is also one of the reasons why, if you are doing ultrasound for collagen building, stick to Ultherapy rather than HIFU, because Ultherapy allows you to visualize. Clinical studies also show that you need a certain number of pulses or lines in order to get the best result. Make sure that the procedure is done in the correct way. There is no shortcut to getting the best and the safest result. If you have any questions about the Ultherapy, Visualize and Personalize program, don't hesitate to reach out to us. I am Dr. Sylvia, and I am here for you.